Hi, my name is Siyu Sun, Professor and Chief of Endoscopy Center at Shengjing Hospital, China Medical University, which is one of the biggest hospitals in northeastern China, with more than 6,500 beds and over 130 years of history. I'm so glad to have this opportunity to present our study that will be published by GI Endoscopy. We conducted the study entitled Acellular dermal metric for esophageal stricture prevention after endoscopic submucosal dissection in a porcine model. Why did we do this study? Endoscopic submucosal dissection has been widely applied for early esophageal cancer. However, there are still some limits for clinical use, especially for these near circumferential esophageal lesions. Patients undergoing intensive ESD will develop a severe esophageal stricture in up to 90% of cases. It's Achilles heel of this technique. It will reduce the life quality of the patient. Traditional treatment may either last a long treatment period and put the patient at risk of adverse events. Thus, stricture formation after extensive ESD remains challenging. As the most promising strategy for the regeneration medicine, tissues biomedical engineering has attracted a great deal of attention. Extracting ADM from animal tissues by decellularization process has become a general methodology for obtaining high-performance tissues engineering scaffold because the decellularized matrix processed natural polymer biocompatible with cell and tissue growth, as well as native progress structure suitable for cells infiltration and tissue regeneration. The ADM graph is wide and translucent. It's derived from the master bovine skin. It's sterilized before use. The removal of the cellular component greatly reduced the incidence of immune injection. The collagen scaffold and basement membrane allows the rapid cell repopulation. It has been shown to promote the tissue remodeling in different wound healing processes. ADM grafting is being investigated in clinical trial in many fields, including the repair of skin, oral mucosa defect, breast reconstruction, and so on. The excellent outcome has been reported. We are enlightened from the study, since the esophagus is lined by mucosa composed of a similar squamous cell epithelium. So we think it can be applied to this endoscopic field. Is present a logical advance. We designed a semi-cellular ESD technique in porcine in order to evaluate the effectiveness of graft implantation and prolong the observation time. The membrane was trimmed according to the size of the resection mucosa and shocked in saline to 60 seconds. And then it's become soft and easy to deform. The membrane was grafted with forceps and transported to the outer side under the protection of the transparent cap. We use the metal clip to fix the ADM graft, and it's easy to manipulate it during the procedure. 6 to 8 metal clip was used to attach the graft and the edge of the outer bed, resulting in the close adherence. In current literature, some studies use the self-expanding stents for scaffold fixation and got a negative result. I don't think it's a good option because the stent compression may lead to ischemia, which is not conducive to ADM transplantation and ulcer healing. This is the first study in which ADM grafts has been successfully placed in the esophageal tract with a metallic clip. The local effect of ADM provided a favorable environment for ulcer healing. This study has shown effectiveness of ADM graft implantation for prevention of the esophageal stricture after ESD, compared with the control. Early epithelialization and minimization of the associated inflammation and organized tissues remodeling are thought to be mechanisms by which ADM implantation promotes the ulcer healing. In this study, the metal clip was effective for endoscopic suture of logic scaffold and esophageal wound. The application of cellular dermal metric is feasible and effective for esophageal stricture prevention. What should come next? Firstly, we will explore further the repair of artificial ulceration after entire circumferential ESD for fixation of the ADM in mucosa defect. Secondly, we develop a dedicated suture device for fixing the ADM and make it easier to perform this procedure. Thirdly, after further animal studies with a large sample size, we try to translate the result of the animal study to clinical practice. Thank you very much for accepting our study for publication and a kind invitation of this interview. With the impact of the GIE journal better and better, thank you.